The warning signs your lungs may be sending. Many people believe that lung cancer always announces itself loudly. They imagine dramatic symptoms, severe pain, constant coughing, difficulty breathing. But the truth is often very different. In many cases, lung cancer begins silently, very quietly. Sometimes the earliest signs are so subtle that people ignore them for months, even years. As a doctor, I often remind people that the human body has an extraordinary ability to communicate with us. But these messages are rarely dramatic. Instead, they appear as small changes, a cough that does not go away, a strange feeling of fatigue, a slight pressure in the chest, nothing that seems urgent. And that is exactly why lung cancer can remain undetected for a long time. Your lungs are remarkable organs. Every minute, they exchange oxygen and carbon dioxide with incredible efficiency. With each breath, oxygen travels into the bloodstream and fuels every cell in your body. Your brain, muscles, and heart all depend on this continuous supply. But because the lungs have very few pain receptors, serious problems can develop without causing immediate pain. This means that even significant changes inside the lungs may not produce obvious warning signs early on. One of the first symptoms many patients notice is a persistent cough, but not just any cough. It is a cough that does not disappear. It may start as something mild, something that feels like a cold or seasonal irritation. At first, it may appear only in the morning. Then it slowly becomes more frequent. Days pass, weeks pass, and the cough remains. Many people assume it is caused by allergies, pollution, or a simple respiratory infection. But if a cough lasts longer than 3 weeks, doctors usually recommend further evaluation. Another early sign can be a change in the character of an existing cough. This is especially important for smokers or former smokers. Someone who has had a mild cough for years may suddenly notice that it feels different. It becomes deeper, more persistent, more irritating. The body is trying to signal that something inside the lungs has changed. But coughing is not the only signal. Some people experience shortness of breath earlier than expected. At first, it may appear only during physical activity. Climbing stairs may suddenly feel harder. Walking long distances may feel slightly uncomfortable. But because these changes happen gradually, people often attribute them to aging or lack of exercise. The truth is that the lungs have a large reserve capacity. Even if part of the lung is not functioning normally, the rest can compensate. And this is why lung diseases may progress quietly. By the time symptoms become obvious, the condition may already be advanced. This is why early awareness matters. Understanding the subtle signals your body sends can make a profound difference. And while these symptoms do not always mean cancer, they should never be ignored. Because the earlier a problem is detected, the greater the chance of successful treatment. But coughing and shortness of breath are only the beginning. There are other warning signs that many people overlook completely, and some of them appear in places you might never expect. Symptoms that many people ignore. One of the most surprising things about lung cancer is that its symptoms do not always stay in the lungs. In fact, the body sometimes reveals early warning signs in unexpected ways. Many patients remember a moment when they first noticed that something felt off, not necessarily painful, just unusual. One of these signals can be persistent fatigue. Now, fatigue is extremely common. Modern life is busy and stressful. People often sleep less than they should. So when someone feels tired, they rarely consider that it could be related to lung health. But when fatigue becomes constant, when energy levels drop without a clear reason, it can sometimes reflect deeper physiological changes. Your lungs supply oxygen to the bloodstream, and oxygen is essential for producing energy in the body. If oxygen delivery becomes less efficient, the body may respond with fatigue. This does not mean every tired person has lung disease, but unexplained exhaustion should always be taken seriously, especially when combined with other symptoms. Another possible warning sign can be chest discomfort. This is not always sharp pain. In many cases, it feels more like pressure or tightness. Some patients describe it as a dull ache that comes and goes. Others feel it when they cough or take deep breaths. Because the sensation is mild at first, people often ignore it. But persistent chest discomfort should always be evaluated. There's also a symptom that many people find alarming when it appears. This is coughing up blood, even in small amounts. Medical professionals call this hemoptysis. Sometimes it appears as streaks of blood in mucus. Other times it may be barely noticeable. Even a small amount of blood during coughing should never be ignored. Although it can be caused by infections or inflammation, it can also be associated with serious lung conditions. Another important symptom is unexplained weight loss. When the body is fighting disease, metabolism can change. The immune system becomes more active. Energy demands increase. As a result, some people lose weight without trying. If someone loses a significant amount of weight without changes in diet or exercise, it is important to investigate the cause. And there is one more symptom that surprises many people. It is hoarseness of the voice. Tumors located near certain nerves can affect the vocal cords. This may lead to a voice that sounds raspy or weak. If hoarseness lasts for several weeks without improvement, doctors often recommend examining the lungs and surrounding structures. These symptoms do not always indicate lung cancer. Many other conditions can produce similar signs. But the key message is simple: awareness. The body rarely hides serious problems completely. Instead, it sends signals, and learning to recognize those signals can help people seek medical attention earlier. But symptoms alone cannot confirm a diagnosis. To truly understand what is happening inside the lungs, doctors rely on modern medical imaging and diagnostic technologies. And these technologies have dramatically improved our ability to detect lung cancer earlier than ever before. How do doctors actually detect lung cancer? When people hear the words lung cancer, one of the first questions they ask is simple: how do doctors actually find it? The answer is that diagnosing lung cancer is rarely based on a single symptom or test. Instead, doctors use a combination of medical evaluation, imaging, and laboratory analysis to understand what is happening inside the lungs. The process usually begins with something very basic: a conversation. Doctors ask detailed questions about symptoms. How long has the cough lasted? Has the breathing changed recently? Is there chest discomfort? Has there been unexplained weight loss? Medical history matters greatly. Smoking history is an important factor because tobacco exposure significantly increases the risk of lung cancer. But it is important to understand that lung cancer can also occur in people who have never smoked a cigarette. Other factors such as environmental exposure to pollutants, certain chemicals, or secondhand smoke can also influence risk. After discussing symptoms and history, doctors often begin with imaging. One of the first tests may be a chest X-ray. An X-ray can sometimes reveal unusual shadows, masses, or areas where lung tissue appear different from normal. However, X-rays have limitations. Small tumors may not always be visible, especially in early stages. That is why doctors often recommend a more detailed scan called a CT scan, or computed tomography. A CT scan produces highly detailed cross-sectional images of the lungs. Instead of a single flat image like an X-ray, a CT scan allows doctors to see the lungs layer by layer. This makes it easier to detect small abnormalities that might otherwise remain hidden. CT scans can reveal small nodules in the lungs, changes in lung tissue, enlarged lymph nodes, or suspicious growths. Sometimes these nodules are completely harmless. They may represent scar tissue, old infections, or benign growths. But when something appears suspicious, doctors investigate further. At this point, another question becomes important. Is the growth cancerous or not? Imaging alone cannot always answer that question. To confirm the diagnosis, doctors often perform a procedure called a biopsy. A biopsy involves taking a small sample of tissue from the suspicious area. This sample is then examined under a microscope by a pathologist. The pathologist looks for abnormal cells and determines whether they are cancerous. There are several ways doctors can obtain a biopsy. Sometimes a thin needle is inserted through the chest wall under imaging guidance. In other cases, doctors use a procedure